The mitral valve is a very complex valve. The aortic valve is like it's an odometer of a car. You take it out and you put a new one. Right. Very simple. The mitral valve is complex. It's like the a cockpit of a 747. Very complex. Okay, and when it becomes dysfunctional, it could be primary. When it's disease of the valve itself, the leaflet prolapse. That's a prolapse of the leaflets. They can trigger severe mitral insufficiency. So it is an anatomic condition that predisposes the patient to have a malfunction of the valve, which in this case will be mitral insufficiency severe. So in a young patient, when you have severe mitral insufficiency, one of the most beautiful operations is repairing the valve. So the surgeons come in and do a beautiful operation that they repair the valve, leaving the same valve, but just repairing the valve surgically. And it can be done minimally invasive if only the valve needs to be repaired, or it could be conventional, but it's an open heart surgical procedure. So when we talk about minimally repair in surgery, it doesn't mean that it's only talking about the incision is small, but the surgery is big because the patient has to go in a heart-lung machine. That's what makes the surgery complicated. So the treatment of choice for that is really surgical repair or replacement of the valve, depending on the conditions. Now, when the patient gets sicker and complex, then is when we can do mitral valve repair through transcatheter therapies. We can do with the mitral clip.
Right.
Okay, and or replace the valve also via percutaneously. So I had a patient recently who was transferred from Panama by air ambulance. This is a young patient who was in refractory congestive heart failure, intubated for a month. They had to do tracheostomy and put him on a ventilator. And he had severe primary mitral insufficiency. When I say primary, because it was flail leaflet or flappy leaflet, it's called flail. And the patient was in a condition that at that point was not a surgical patient. So he transferred the patient and we did a transcatheter mitral valve repair with mitral clips.
Right.
And after doing that and removing all that stress on the valve and making the valve functioning normally, we reduce the amount of mitral insufficiency from torrential, which is severe, to trace mitral insufficiency, which is a spectacular result. All the pressures inside the heart, they drop more than half. To make the story short, that patient, we were able to wean him off the ventilator, take it off the tracheostomy tube, bring him back to normal. The patient went home back to Panama, and they sent me a video, which is an incredible video because the patient going back to his normal life. This patient was basically totally in the tunnel. He was on the way out. He was in refractory cardiac shock and congestive heart failure. All the organs were failing, and all the organs came back. And he recovers. And it was an incredible save and results, and involved everybody who took care of this patient, implying we did the procedure, of course, but the intensive care pulmonologist, therapist, then rehab, physical therapy, because all these patients, after almost 2 months of being in a bed, they become very compromised. So this patient did extremely well, thank God.
Did you know how he came about coming here to MCVI, and what was the connection?
Well, of course, we have relationships with physicians in Panama. One of my partners is Panamanian, Dr. Alvaro Gomez, and one of the doctors who was taking care of this patient knows knew us because we have been there giving lectures and stuff, and they knew the work that we do here, and they knew Dr. Gomez, and through that connection, they referred the patient, and we transferred him here. We have done several patients from Panama before, and thank God with good results. So they knew the kind of work that we do at MCVI.
And I've written before about mitral valve repairs. I've interviewed you before on this. You've been doing this for years, right? I mean, mitral valve.
Actually, we were lucky enough that we were one of the original investigators when we started doing the first trial on mitral valve repair with MitraClip. That was back in 2005.
Right.
And we've been doing it. We were the only site in Florida for more than 10 years. We participate in all the trials up to the approval, and we're still doing. We're doing several trials. One is called Summit, which is transcatheter mitral valve replacement with a valve that is especially designed for the mitral valve, for the mitral position.
Yeah, we did. That's the interview on that gentleman, unfortunately.
But it has to do with the valve. The guy, that patient had a different bad outcome, but not because the procedure was because
I know
something different.
Let us know if there's any other developments with Summit as we move forward.
Yeah, we're enrolling patients now again, and the pandemic slowed us down, but now we're back in the trenches, and I think we have 2 patients ready to go.
And then getting back to the term floppy valve syndrome, is that a symptom of MVP, or is it something that can be separate and not have MVP? Or
no, they call it floppy valve syndrome because it's a degeneration of the mitral valve. It's a myxomatous degeneration of the mitral valve, and actually the name is Barlow. Because that was the physician who described it first. And the anatomy of those valves is they're very floppy.
Right.
Of course, they produce severe mitral insufficiency, and that's a very complex anatomy to repair surgically or with do transcatheter approach.
So floppy valve syndrome is more of a larger term
for young patients to have this.
Floppy valve?
Like the closure of the valve?
Or
closure, repair.
I'm sorry, yes, repair. Is that common for a young patient to have?
Well, this is a degeneration of the mitral valve because the myxomatous tissue, the valve become very redundant.
Right.
You see it in my hands? Opens and closes and flies around. And when you do that, then you leak. And when you're leaking, is when you have microinsufficiency.
Right.
So those valves are difficult to repair because you have too much tissue. You have to remake the valve, basically.
Oh, do you have the age of the gentleman from Panama, roughly? How old he was, or he is?
I think he was in the late 60s, early 70s. I don't have the age with me. I have I have it, but it was relatively young. If this patient was being so sick, the patient would have a surgical repair.
Right.
But he was too sick for surgery.
Would he be? We can do Zoom video interview and even tape it. Would he be a willing person to do a testimonial for us, or you think? Or?
Give me 1 second. Hello. Yeah.
Oh, if he speaks, assuming he speaks English, but I don't know.
The patient is in Panama.
Yeah, but
I think your video. Now he's going back to his normal life, walking and everything. I think he will be very happy to do a video,
interview.
Be interviewed. Now that we have Zoom.
I know. Yeah, we can do.
This would be a great case.
Yeah, I think.
How can we get his contact information?
Lisa Fernandez in my office.
Lisa Fernandez. Okay.
And do you know?
And do you know the gentleman's name?
She's getting to me. I think.
And the other important thing is that does he speak English?
The patient can speak English. Nobody in his family speaks English. His son is very, they're very educated people.
Okay, yeah.
I didn't talk to the patient until a month later, when she
Wow.
was ready to go back home.
Oh, wow.
Because when I met the patient, was intubated with a custom tube.
Right.
And I didn't, it went 3 weeks after I did it before we can talk to the patient.
Right.
So.
And was he referred to you, Dr. Quesada?
Yes.
Or did they find you?
No, the patient was referred to me.
They knew you,
Okay.
the doctors there knew.
And yes, I'm gonna have to make sure. I had a patient in the emergency room with a heart attack. It's fine. No, it's the other patient. The patient from Guatemala.
Okay.
But at least I can give you the name of this guy. They're from Panama. I forgot his name. I'm sorry about that.
Don't worry.
No, it's
I'll
okay.
find it.
We'll get it, yeah.
Or the girls on the structural team, Gilda Green.
Okay. Patient. Okay.
Okay, but I have to go to the emergency room.
All right, thank
Okay,
you, doctor.
don't worry.
We'll be in touch. Thank you very
All
much.
right.
Okay, thank you, doctor.
Okay.
Take care.
Bye.
Bye.
Hold on, Carmen, hold on. I'm trying to. I'm getting the circle of, the color circle of death here on my laptop, and I want to make sure I'm off.
No, you had you froze.
Oh, I froze, yeah.
Yeah.
I think he did too. I think maybe it's a connection or something. I mean,
No, you was fine. I was telling you, but you were frozen.
oh, I was?
Yeah.
That's weird. Yeah, I'm getting the color wheel of death here. Let's see.
Color wheel of death.
On the Mac laptop, that's what they call it. I mean, it's stalling. I can't do anything. I'm trying to see if I can control command or shift command delete. I forget what this is. Control option delete.